Hi, everybody. I'm Macy Jepson, and I'm your moderator for this Lunch and Learn today. This is a sustained dialogue series on diversity, inclusion, and equity, creating an inclusive environment for LGBTQ and gender care patients and for our caregivers. Thank you so much for joining us today. We really appreciate it. Before we get started, I've got a few housekeeping notes for you. We are going to ask you to submit your questions. This is an open Q&A. There's a pop-up window in your Zoom toolbar. You can type in your question there and you can click send. This webinar also being recorded. So a video recording is going to be available after this event on the digital workplace. You can tell your coworkers about this if they missed this event, and tell them to look to the digital workplace within the next week, and we will have this recording for you. So again, you're muted for this event. So any questions, and we welcome and want to hear from you. We welcome your questions. So we ask that you use that Q&A pop-up window. I'm Macy Jepson again. I'm your moderator, and I would like now to introduce our guest speaker for today. With more than 20 years of clinical experience ranging from emergency medicine to cardiology, pediatrics and family medicine, and a BA in gender studies and conflict resolution, ChrisTina Reed is excited to be an integral part of the team at UH, ensuring quality services to the LGBTQ plus community, and we are so happy to have her with us. In 2015, ChrisTina founded the Transgender Medicine and Surgery Program at Cleveland Clinic. That program quickly grew to service more than 2,000 individuals and continues to thrive today. ChrisTina joined University Hospitals in May of this year. She is a newbie with us as the LGBTQ plus and gender care manager. And as you can see, we have quickly put her to work today. ChrisTina looks forward to creating an inclusive environment for caregivers, patients, and their loved ones, and fostering a strong bond between UH and the LGBTQ plus community. And we're going to learn more from her today about how we can be a part of that process. ChrisTina, thank you for joining us. Take it away.
Macy, thank you so much for the wonderful intro. Welcome, everybody. Thank you so much for taking time out today to share with me. I'm really excited about the opportunity. So just to open, a couple of objectives. So I just want to start off by saying that, my goal is never, ever to change someone's values or, to challenge someone's morals. My goal is always just to kind of provide information just to help you more effectively communicate and just to help you provide more competent care. So our goals for today, by the end of this session, all the participants should be able to kind of competently discuss inequities that are experienced by gender expansive individuals and their loved ones, and being able to use language that's respectful and inclusive of all identities, all orientations. We'll get into that a little bit more later. We'll discuss some terminology that's applicable, again, to identities and orientations. We'll discuss how gender and sexual diversity has evolved a bit over time. And you'll be able to navigate some challenging situations occurring from just a lack of understanding about identities and orientations and the specific needs that pertain to those. So again, I welcome any questions and comments. I hope to have a kind of an open communication with everyone today. And hopefully we'll be able to answer any questions that you might have and give you some resources. So why is this service line important? Why is UH dedicated to this service line? So there are over 40,000 self-identified transgender individuals in Ohio. And if we look at downtown Cleveland, within a 15-mile radius, there are more than 130,000 self-identified members of the LGBTQ plus community. Within the US, there are greater than 5% of adults that identify in this demographic. So these are members of our community. They're our brothers, our sisters, our children, parents, colleagues, caregivers. Oftentimes what I hear when we're having these discussions is that, this doesn't apply to me. This doesn't affect me. I don't know anybody that identifies as transgender. But given the statistics, that statement is likely not very accurate. So it strongly suggests that, perhaps the individual who maybe thinks that way or feels that way simply doesn't have the skill set to be perceived as approachable or to be perceived as a safe space for LGBTQ plus, people to feel safe in openly communicating with. So, when you think about that as perhaps being your children or your grandchildren or your loved ones, it just strongly urges action. And what action? So participating in programs like this, where we just educate ourselves about these topics. So I want to go into just some basic terminology, some basic concepts that may prove helpful when we're having these discussions, right? So this is by all means not an all-inclusive list of terms, but just ones that often come up in discussion and terms that are important to have some understanding around. So beginning with allies. What are allies? So allies are people who support and respect the members of the community. These are people that are dedicated to taking action to support members of the community, right? So you can say, well, I'm an ally, I'm perfectly okay with it, whether it affects me or not. But an ally, a true ally, is also not afraid to say, if you happen to be in the cafeteria and you overhear a conversation or someone who is, being mistreated, being willing to step up and kind of intervene and say, hey, maybe I could help offer some additional conversation around this. Allies are incredibly important to the community because, simply stated, there's safety in numbers, and just having someone who's willing to use their privilege to stand up for the rights of other people who are discriminated against is incredibly powerful. And when we talk about privilege, we'll get into that a little bit later in the discussion. Another term that is helpful to have a little understanding around is the term asexual. So a person who is asexual experiences little or no sexual attraction to others, or perhaps a lack of interest in sexual relationships and or behaviors. It's also important to understand that is not a mental illness. It's not, it's not a dysfunction of a human. It's just that they just don't have that particular interest. And we'll get into all of this in more detail again later on, but also a person who identifies as bisexual. It's a person who is emotionally, physically, and or sexually attracted to people like themselves and other people that may be different than themselves. So oftentimes, or previously, people thought of bisexual as meaning two genders, right? So attracted to males and females. But I challenge you to kind of reconsider the thought behind that term and think of it more as, again, someone that's like me and someone who may be different than me. The term cisgender is a really important term. So a person who is their sex assigned at birth matches their gender identity. So someone who was, say, assigned female at birth still identifies as female today. That person likely identifies as being cisgender. There is a lot of privilege in being cisgender, which is really important to fully comprehend, right? So someone who's cisgender doesn't have to have concerns about what bathroom do I use, or how do other people perceive me in terms of my masculinity or my femininity. It's just, I wake up in the morning, I get dressed to leave the house. I leave the house feeling fully confident that the way that I see myself is also the way that other people are going to perceive me. And that's very powerful. Again, that's privilege. So that's a very powerful privilege to have, to be able to just, I have to go to the bathroom. I'm just going to go into the bathroom that I'm comfortable using and not have to worry about my safety or have to worry about being questioned, my motives, why I'm there. So those privileges are incredibly powerful. Genderqueer is a term that a lot of people are not super comfortable with. And it's important to kind of recognize the meaning behind that. So someone who identifies as genderqueer basically means that someone who doesn't necessarily resonate with the concepts of being man or woman or masculine or feminine. So, they may appreciate and resonate with certain details of each of those concepts, but maybe not fully identifies with either or. And again, we're going to talk more about masculinity, femininity, and identity a little bit later on in the discussion. Heteronormativity. So this is actually, I don't know how many of you have played Cards Against Humanity, but I always cheer when I get this card in that game. So heteronormativity is the assumptions and kind of the social contracts that go along with being heterosexual or in a heterosexual relationship. Basically, so a good example would be, if learning someone that's married, just automatically asking that person, oh, what is your husband's name or what is your wife's name? Just those assumptions that that kind of go along with those social contracts or social norms. So the way to kind of navigate those discussions is replacing that language. So instead of asking, oh, what does your husband do? Oh, what does your partner do? Or what is your partner's name? Instead of using those binary specific languages when we talk to other people. So homosexual is kind of an outdated term. So now instead of using the term homosexual because it's been used kind of in a derogatory fashion in the past, we often prefer to use gay or lesbian in place. But it's basically referring to someone who is primarily emotionally, physically, or sexually attracted to members of the same gender or the same sex. Intersex is an important term. So it's used to describe a combination of chromosomes, gonads, hormones, internal sex organs, and genitalia that differs from what would be expected at birth. So the outdated or formerly known term is hermaphrodite. Is very outdated and derogatory. So intersex is the term that's now used in place of that. The term intersex in itself is also kind of can be an emotionally loaded term when you're talking to an individual who may not necessarily identify that way. From a clinical perspective, intersex, the term itself, has its place in medicine. So for instance, when I'm working with a patient and we're working, say, with their insurance to try to get the services covered for them, intersex condition is a clinical diagnosis that I will often use to explain to their insurance why these services are important and why we need these services covered. So say surgery, for instance, I will use the ICD-10 code for intersex to explain to the insurance that, you know, this person was assigned a certain gender at birth that doesn't align with their identity. And in order to help their dysphoria, which is the term used to describe that condition, you know, this is why this service is necessary for them. So intersex, again, it can have kind of an emotionally loaded connotation to it, but also does still have its place when we're talking about medicine and clinical diagnoses. Pansexual refers to a person who experiences attraction for members of all expressions and all identities. So when you think of reflecting back on someone who identifies as bisexual, again, people think of bi meaning two. So someone who is like me, someone who is not like me, or someone who is masculine or feminine. But when you're talking about wanting to have an expression for someone who perhaps may be romantically attracted or in a relationship with someone who may be non-binary or genderqueer or gender fluid, we need a term that kind of encompasses all of those identities and all of those perspectives. So that's where the term pansexual comes useful. Pansexual is just someone, it's more inclusive, they're in a relationship or attracted to people. Basically, hearts, not parts, is a way to kind of summarize that. Just attracted to someone for who they are, not necessarily what they are. So pansexual is a useful term to kind of encompass that. Passing is a term that's really important when we're talking about transgender individuals, particularly. So again, you know, when I wake up in the morning and I get dressed, do I have to be concerned about how others will perceive me in terms of my masculinity or my femininity? Am I going to be perceived by others the way that I see myself? So if I identify as a female and I leave the house dressed however I'm comfortable for the day, are other people also going to see me in the same way? And you know, when we're thinking about safe spaces and places that we go, you know, if I walk into a female restroom, is that going to be a safe place for me? This is really important for members of the transgender community. Oftentimes what we see is, especially if their expression or if the way they're perceived maybe doesn't necessarily match, you know, their identity, if they walk into a restroom, again, their motives may be questioned. Their safety may be at risk. They can be victimized and sometimes attacked in those spaces by people who may not necessarily understand that. So passing is basically, I leave the house, I know that I am perceived by others the way I see myself, and I feel safe in that space. Passing can also be a term that applies to orientation, right? So being lesbian enough, or being gay enough, or being straight enough, right? So there are a lot of kind of separations within the community, and a lot of kind of innuendos that a lot of stereotypes that people, you know, feel they have to dress a certain way or carry themselves a certain way, behave a certain way in order to be perceived enough within the community, right? So for instance, a lesbian who has children may not be perceived as being lesbian enough, or you know, a straight person who maybe expresses themselves maybe not super masculine or super feminine, maybe, you know, their orientation may be questioned. So that's where the term passing comes into play. The term queer is a term that we often have a lot of dialogue around, and it's one that a lot of people are not comfortable using because it's been used as a derogatory term often in the past. But it's basically an umbrella term that describes individuals who don't identify as straight. It can also be used to also encompass identity, like gender identity. So again, going back to genderqueer. Again, a lot of people don't have a comfort level using the word queer because of the history behind it. It's kind of been used by members that are part of the queer community to kind of empower themselves. So they're reclaiming that term and using it as a way to empower themselves. My best advice behind using the term queer is use it in a space where you know people have a comfort level with that term. And if you're not comfortable using it, that's okay. You don't have to leave this discussion today and use all of these terms that we're going over. If you're not comfortable using the term, it's okay, just don't use the term. But just have an awareness that if you hear other people using that term in a positive way, just recognizing that some people do have a comfort level and do comfortably use that term. So questioning is a term that's used to describe an individual who, or a time where they're kind of exploring their orientation or they're exploring their identity. And this can happen not just once in someone's lifetime, it can happen throughout the course of somebody's life. And we'll talk a little bit more about that concept and that process a little bit later. But it's basically just kind of reevaluating one's self and kind of where they're at on that trajectory. Sexual orientation, relatively simple concept, just talking about basically who one is attracted to. Transgender, again, an umbrella term, just talking about people who maybe don't identify with those societal contracts or those gender norms. So for instance, someone who was assigned female at birth doesn't feel that applies to them. They don't feel comfortable in those spaces. It just doesn't feel like who they are and identifies as male or vice versa. So basically just doesn't necessarily feel that that they resonate with the gender they were assigned at birth. So based on their anatomical sex. So I want to talk about, this is actually one of my favorite stories. So this is Ryland's story, and you can find this on YouTube. And this is a beautiful story about the life of a transgender individual. So this was produced in, I believe, May of 2014. So Ryland Whittington was born in 2007 and assigned female at birth. Around Ryland's first birthday, they learned that Ryland was deaf. So they had cochlear implants surgically performed. You know, they thought as parents that this was going to be the biggest challenge that they would face with Ryland. Around Ryland's, basically as soon as Ryland began to start speaking after having those cochlear implants, Ryland began to verbalize dysphoria. So that incongruence between being assigned female at birth and the way Ryland saw himself in terms of his identity. And very soon after learning to speak, he would scream, "I am a boy." The family, you know, it took a lot of communication, a lot of exploration, and they just kind of watched Rylan for a while. But this dysphoria, this incongruence between being assigned female at birth and the way Rylan saw himself started to become more and more obvious. And Rylan started to exhibit some shame when having to wear like female clothing and engaging in like activities that are consistent with being female. At one point, Rylan said, "When the family dies, I will cut my hair so I can be a boy." And through tears, he asked his parents, "Why did God make me like this?" So Rylan's parents, it became more and more aware that they needed some help. So they sought out the help of some professionals, and they all, through the process of working with these healthcare professionals and mental health professionals, they realized that Rylan is transgender, and through the Williams Institute, they did some more exploration and some more research, and they learned that 41% of transgender people have attempted suicide due to just a lack of social understanding, a lack of social support. So for Rylan's well-being, they decided that they really needed to allow him to transition as soon as possible. Just for some background and some understanding. So we start to develop our sense of ourselves roughly between 3 and 5 years of age. So it's very early on that we start to identify as, do I see myself as a boy or a girl, or something else, or masculine or feminine, or none of the above, and how we see ourselves in terms of developing just as a human. So although Rylan was assigned female at birth, he strongly identifies as male. So the family decided to cut his hair, and they changed his room from pink to blues and greens and yellows. And they sent out letters to their family and their friends to kind of explain what was going on. This is their family. I really encourage you to look up this video because it really is a beautiful story. And there are other videos that the family has also put out as well that kind of update a little, give more details about the story. So these photos were taken roughly a year ago, and Rylan, let's see, he would be, I think roughly, he was 12 in these pictures. I think he's about 13 now. And you can see he's just kind of a happy, kind of normal sort of kid, a big brother to his little sister. And he's pictured here with his sister and his parents. If you look up the details, they can tell you more about kind of the challenges they faced as a family and as parents. But this was definitely, they all still agree this was the right decision for Rylan, definitely. So with that, I want to just kind of go into some of the concepts around identity, attraction, gender, orientation. So it's really important to understand that there's a big difference between gender identity and sexual orientation. So those are, that's where people tend to get kind of in the weeds. They get very confused. They are not one and the same. So if we break this down, here we have a picture of our genderbread person, right? So this is just a human individual. And if you look at the brain, so that's talking about our identity, right? So our identity, our gender identity is the way we see ourselves and the way that we hope others perceive us in terms of masculine or feminine or none of the above. There are individuals who don't see themselves as either of those things, or maybe fluid on that spectrum, right? So just how other people see us. When we look at the heart, we're talking about our orientation. So who we find ourselves attracted to, and that can be broken down into a whole other presentation, but basically, who we find ourselves spiritually attracted to, romantically, physically, intellectually, sexually attracted to, and they may all be in one individual. They may not all be in one individual, right? So I can be attracted to someone spiritually, but maybe not necessarily physically, or I may be intellectually attracted to someone, but not necessarily want to engage sexually with them. So there are many different levels of attraction that make up our orientation. When we're talking about sex, right? So we're talking about our gender. So the anatomical characteristics that make up who we are as a body. So our combination of hormones, our chromosomes, our body parts, right? Those secondary sex characteristics that develop as a result of our combination of all of those things, our hormones and our chromosomes and all of those things, right? So that's basically our gender or our sex. So when we're talking about the sex assigned at birth, those are the things that people typically take into consideration when they're discussing that. So if you look at this outside dotted line, it's referring to our expression. So in terms of our gender expression, we're talking about the things that we do that give out the message to society and to other people about how we want to be perceived in terms of, again, masculinity, femininity, or none of the above. So our clothing, our hairstyle, makeup, whether or not we choose to wear it, jewelry. Beyond that, it also encompasses the way we carry ourselves, the way we sit, the way we talk, the inflection in our voices, the activities that we engage in, all of those little pieces of information that we send out throughout the course of every moment of our being. And those are the messages that we send out to others about how we want to be perceived. So when we break this down even further, sometimes it's helpful to understand that these are all, think of them on a sliding scale, and some people are very fixed on those sliding scales. Some people are more flexible on those scales. So when we talk about our gender identity, how fixed or how flexible we are in terms of the way we see ourselves in femininity, masculinity, how we express those things to others, or maybe not at all. Maybe we don't see ourselves as any combination of masculine or feminine. The same applies to our expression, the way we send messages out to others about how masculine or feminine or not we are. And the same thing with our anatomical sex. So this is something that can change throughout the course of our lives, not dependent on our identity or our orientation. So if you take, for instance, someone who was assigned female at birth that perhaps had a hysterectomy, right? So perhaps they don't necessarily have all of those body pieces that we may see as being present in someone who was assigned female at birth. So this can be applied to any human across the trajectory. And it's also important to understand that our identity does not equal our expression. It does not equal our sex. Our gender does not equal our sexual orientation. So the best way that I can simplify or summarize this up for you is that these are not labels that we should ever assign to someone else. The best way is to always allow someone else to tell us their story, right? Because this story belongs to them. It's not our story to give them. So it's always something that we should allow other people to explain to us. So what is LGBTQ plus and gender care? So it's under the direction of Dr. Shubham Gupta. And I am exceptionally proud to report that we are the first surgically comprehensive gender affirming program in Northeast Ohio. And that is just epic. So when I say first surgically comprehensive, we offer every surgical service that someone could ever ask for to help them feel more comfortable in their identity. So head to toe services. In addition to that, we have just comprehensive care, everything from emotional support, mental health care, primary and family care, voice services, from voice therapy to surgical therapy, fertility services, literally every service that anyone could ask for to support their wellness and their health throughout their journey of their lifetime. We also support the community by offering community engagement, community support, research, outreach, medical education. We really want to foster, we work hard to foster a relationship within the community and the hospital enterprise to really make sure that all of the needs are met. So again, we have primary care, family medicine, emotional support, pediatric medicine. Again, we start to develop our sense of who we are in terms of gender at a very, very young age, between like 3 and 5. So we have mental health providers that work with our young people. We have pediatrician and pediatric providers that offer puberty suppression. That's a bit of a hot topic if you research that, but basically puberty suppression is literally just hitting the pause button. So it pauses the onset of puberty to allow an individual to mature socially and emotionally a little bit more, while they continue to look more into their identity and their goals and work with the family. And then at some point when that person has reached a higher level of maturity, if that dysphoria persists, then they can choose whether or not they want to start cross-sex hormone therapy. The beauty of that is that it eliminates the secondary sex characteristics that develop during that time. So either the development of breasts or body hair or deepening of the voice. So we avoid all of these things very temporarily, so that if the right decision is to start gender affirmation services in terms of cross-sex hormone therapy, we don't have to work as hard to reverse those secondary characteristics that have developed. We also have providers that are experts at cross-sex hormone therapy. We offer surgical services, all of the ancillary services. So if someone needs, they break a leg and they need an ortho provider that is affirming, we have those connections as well. My contact information is here and at the bottom of each of the slides. In case there are any questions or referrals for patients, I encourage you to always share my email and the phone number with your colleagues and our patients, and I'm always happy to offer any assistance that I can. So these are some resources, and this is being recorded, so these are also available to you after today. But these are some great community partners and some resources to support the LGBTQ plus population.
ChrisTina, thank you.
Thank you.
As expected, we've got lots of questions
Great.
from our test. We've at the most we've had about 122 people here with us today, and they are engaging. So let's get right to it, okay? One of the first questions when you first started revolves around the number of people who identify as LGBTQ plus. Do you feel that those numbers are increasing over time? And if so, why?
That's a really great question. So it's a little challenging to say because the ability for data collection has been a bit limited. I would say visibility is more accurate. So I wouldn't be comfortable saying the number of individuals that identify this way has increased. I think I can solidly say that the research that is out there, LGBTQ plus people have existed since the beginning of humankind. And there's a ton of really great information around that, but now it's becoming more accepted in society. There are more resources and programs like ours to help support people through their journey. So people are beginning to feel a little bit more comfortable about sharing that identity.
Mm-hmm. Okay. That's understandable. There are quite a few questions about pronouns. So I'd like to just open up the conversation to that for a moment. And keeping in mind, I think that a lot of these questions are for our caregivers to better understand when we're dealing with our patients, but also for our caregivers to better understand when we're dealing with one another in the work environment and making sure that we're respectful across the board. So how do I ask? Is one of the first questions. And if I accidentally get it wrong, then what do I do? So let's start with that first. And when is it even appropriate to have those conversations?
Yeah, so that is an absolutely terrific question. First of all, it's important to understand that people are people, right? So if you have that question, ask. That is so. This is just for background. Has been my life and my passion for well over 20 years. So a very normal conversation for me when I meet a new person, whether it's face to face or over the phone. What do you like to be called? I want to be respectful. How should I refer to you? Or if someone is introduced to me, oh, this is ChrisTina. Oh, ChrisTina, nice to meet you. What are your pronouns? Almost invariably, the response that I get from that individual is, oh, they, them. Thank you so much for asking. And if you're not sure what those pronouns mean, ask for more details. It's okay to say, this is new to me and I want to know more. So if someone says, oh, my name is ChrisTina and I prefer, Z, say, oh, that's new to me. Thank you so much. Can you tell me more about what that means? Or ask them to spell it. And it's okay to say, this is so new to me. And I'm so thankful for the opportunity to learn. If I make a mistake, I hope that you'll correct me. And I really appreciate the opportunity for education. So it's more about the approach and the message than it is the actual verbiage, right? I could give someone a script and they could be reading from a spreadsheet behind their computer, and it's not going to have the same impact or the same message as it would just to come across with honesty and with respect.
Are we, when I say we, UH and you as a manager at UH, are we recommending that these conversations happen in every clinical setting or in clinical settings where people come to us for gender care?
That is an amazing question. Thank you. So not only do I encourage this dialogue in every aspect of our enterprise, I also encourage people to use this dialogue in your daily life, whether you're at the grocery store or you go out to dinner and you want to have a respectful conversation with the greeter or the server or, whoever. This is language that we can use to support society and really make ourselves a safe space for everyone. So to be inclusive in all areas. And, if you work in, I don't know why I keep picking on ortho, but if you work in ortho or if you work in, emergency medicine, our goal is to provide the best care for the person, right? So when we're looking at a person, we may be looking at an injured knee or an injured elbow, but there's a human attached to that. And to be able to treat that person and make them feel confident in our care and to really get the message across that we care for them, it's important to care for the whole person. And again, in our daily lives, when we're having conversations with other people, it's important to be respectful of them as an individual. And this is a great way to go about that. So I encourage that no matter where you are.
Thank you. We have an anonymous question here. I often hear that sexuality and gender are on a spectrum, yet those who identify as LGBTQ are a small minority. How much does the idea of the sliding scale apply to the majority of people?
That's a really great question. So it's very challenging to answer that in terms of statistics because each experience is unique to that individual. So there's no way to say, 20% of people fit on this spectrum, 20% fit on a gender continuum or an identity, an orientation continuum. It's very, very individual to each person. And some people, it's helpful to think of identity and orientation as fitting on a spectrum, but it's also important to understand that, some people are more fixed. Some people may strongly identify one way or another throughout the entire course of their life, whether it's in regards to orientation or identity. Some people may be more flexible. It can change throughout the course of a day, a lifetime. It's very unique to that individual person.
Okay. You touched on numbers and that brings me to another question from Jaleese. What active research studies are being done now for our LGBTQ plus community?
That's amazing. Thank you so much for asking. So we are doing some research, and I have to admit I'm not in research, but I know that we are doing some research around postoperative outcomes, of course. We have some research projects going on in the family and internal medicine areas. If you are a research provider and interested in getting involved in that, feel free to shoot me an email. I will connect you to our research folks, and I'm sure they would be happy to give you more information.
Okay. The questions are just flowing in. This is incredible. So I apologize. I'm just like shooting them out at you, but we're going to get to as many as we possibly can.
That's terrific.
What types of specific healthcare, like physical needs, do members of the LGBTQ community need outside of assistance with transitioning?
That's great. Oh my gosh, I love that question. So of course the care is similar to each of us as a human, right? So we all have the same needs in terms of wellness and health maintenance and things like that. The biggest focus is knowing that we can come to a provider and trust that they are going to care for us in a way that is affirming of who we are and really listen to us when we talk about our orientation and our identities, and not discriminate on those levels, right? So again, things like health maintenance. So I'll give an example. A transgender man who was assigned female at birth still may have parts that would be conducive to someone who was assigned female at birth. So they may have a cervix that requires a pap test. They may have ovaries that need to be monitored to make sure that they're healthy. They may or may not have breasts or breast tissue. A person who was assigned male at birth that identifies as female, whether they are pre or post-op, whether they've had surgery or not, they may have a prostate. So they need a primary care doctor who recognizes that their prostate health is still important. So those, knowing those intricacies, and if nothing else, just having a willingness to learn and look into those things is critical.
Okay. A couple of questions about people feeling safe at UH, making it a safe setting. Tyler wants to know, beyond the services that we offer, what recommendations would you make at a system level to ensure that people feel safe and included? And then there's another question. It was the very first question we got today, and that was, do you anticipate that maybe pronouns can be a part of our badges at one point? Could we get to that point?
Yes, yes, overwhelmingly, yes. Yes. So some of the things that we are doing as a system, we are working really hard to update our data collection. So our demographics portion of our operating systems. So for people that register patients and lay hands on their demographic details, we are working to include preferred names and pronouns. We're working to update registration so that it is more inclusive of these details. The one thing that has come to me in the couple weeks that I've been here, our systems are not currently very inclusive of these details, and oftentimes people who have already legally changed their names and their gender marker may have been registered under previous identification. So what's called a dead name is the name that they were given at birth, and that may or may not have changed, but doesn't necessarily match what is on file with the insurance. So when a patient comes to someone and says like, oh, that's my dead name, my insurance is, James Smith, and my insurance has me as a male, even though I'm registered in the system as, Tina Smith, it's important to go ahead and update those demographics. So the registration has got to match what's on file with the insurance. And it's complicated because sometimes there are discrepancies in those details. Someone may not have legally changed their gender marker, or maybe legally changed their gender marker, but the insurance still has them, incongruently marked. So we're going to be rolling out a lot more education about this as soon as this goes live and our demographics fields are updated to be able to really help people navigate this. But if someone comes to you and you're able to manage their demographics, if they have changed their name and possibly their gender marker or whatever combination, it should match whatever is on file with the insurance. Doesn't matter what is on file with, their driver's license. We don't require that they come to us with legal name documents, name change documents. Simply stated, it should match whatever's on file. If that doesn't match what they prefer to be called, then we should really make really strong efforts to recognize that and still call them by their preferred name and use the right pronouns, regardless of how they're registered. And to answer the question on the name tags, yes, I love that suggestion. That is definitely something I'm going to look into and see if we can go about having that taken care of.
You just described some changes that obviously aren't going to happen as a system overnight when we're talking about the paperwork and all of that. How can caregivers, where can they go? Who can they turn to when they see concerns and they see opportunities for improvement?
Those should come to me.
Okay.
I'm always open to suggestions for improvement and expansion. I love to work with other areas of care, other institutes, other colleagues. I welcome feedback, and I would love the opportunity to partner on some of these initiatives.
Okay.
So please always feel free to reach out, either email, phone. I'm on Jabber most days.
Okay. Jennifer would like to know what services we provide for parents who, are kind of going through the process with a child who is identifying differently than assigned at birth. Do we have any support for parents?
Yeah. So the first suggestion I would make would be to connect with the mental health provider. David Miller is the primary person that I refer people to, both parents and youth, and he can help them navigate, those challenges. There are a lot of challenges that parents of gender expansive individuals go through. Again, that's a whole other presentation, but he is definitely very helpful in navigating kind of that process. I also have some community resources that I'm happy to share with parents that are also going through this in terms of, support groups and things like that. There's an organization called Colors Plus. They are local, and the organization is run by two licensed healthcare providers that work both with adults and youth, and they are an amazing resource for parents, families, siblings, children. So Colors Plus is wonderful.
Okay, thank you. 3 minutes, so we're going to keep on asking.
Sure.
Can you address why self-identification of one's pronouns is important to share, no matter how you identify?
Yes, absolutely. So I always encourage people to include their pronouns on their outgoing communications, whether it's their emails or their name badge, whatever, whatever platform they have available to do that. Number one, it identifies them as a safe space to everyone else. Additionally, it normalizes that conversation, right? It opens the amazing opportunity to have this dialogue with other people. If I'm cisgender, so I was assigned female at birth, I identify as female, and I have, she, her on my name badge, and I happen to see someone in the gift shop and they say, oh, why do you have she, her on your name tag? That gives me that chance that I may have otherwise missed to have that conversation. And it's amazing how you will walk past someone in the hallway, a patient or the family member of a patient, and they see that information or they see that that expression, and you just recognize the smile that it brings them, that acknowledgement, like, yeah, this person's a safe space. I'm in the right place. And that's a really amazing feeling.
Okay, one more question. This is anonymous, and I think this goes back to, our caregivers taking care of each other and making sure that we're respecting each other in the workplace. So what do you suggest on preparing resistant nurses who participate in gender affirmation surgery? So we've had Dr. Gupa come and present excellent presentations. Afterwards, we did have nurses who did not buy into that. They voiced their refusal actually to care for these patients. So how can we provide education to them, and I think equally important, how can our caregiver who's asking this question best handle the situation on the floor?
That is a really great and very challenging question. We all went into medicine, I have to assume, because we want to care for others. We want to give everyone the best possible care. And it's not about what is right for me. It's not about, my morals or my ethics if I went into nursing or whatever area of healthcare I go into. Throughout the course of 20 years of clinical experience, of course, I have encountered people who maybe their ethical values or their moral values maybe don't align with mine, but I went into healthcare because I care about people and because I want to do the best I can to take care of that individual. And if that means, putting aside my differences and putting aside those challenges, I'm willing as a moral human, I'm willing to do that. That can be challenging if you're working with someone who maybe doesn't share that perspective, or maybe doesn't share those values. But I would probably challenge you to have that conversation about, like, we went into healthcare because we want to care for people, and it's not about my story. It's about that patient and how to take care of that patient the best we can. I would also encourage them to engage in more conversation, give them my contact information, let them know that the system, our CEO recognizes that this is the right thing to do, to care for people. And this is a value that UH also recognizes. This is a value that we all have and that we all share.
I think that that's a really important point to make as we wrap up the end of this, is that this is a system initiative. ChrisTina, we're going to be respectful of everyone's lunch hour, and we got to most of the questions. And I would just want to offer you the opportunity to wrap up and say a final few things and to end the webinar. And quickly, I'll just remind everyone that this will be offered in recorded version on the digital workplace through UH News newsletter, and then also through UH4U newsletter as well, coming up in, probably a week or so. ChrisTina, take it away.
Thank you so much, everybody that took your time to share with me today. And thank you for the great questions and suggestions. I love the pronoun suggestion. I really strongly encourage you to reach out. Any questions, any resources that I can provide, I am always happy to do. And thank you so much for everything that you all do. Medicine is challenging, and our jobs are not easy. And I just thank you so much for everything that you do to care for all of us, each of us.
Thank you, ChrisTina. And thank you everyone for joining us on this lunch break. And again, look for a recording very soon. Have a good day, everybody.